What should you expect during stroke surgical clipping recovery? Imagine waking up after a brain surgery designed to prevent a dangerous aneurysm from bleeding. Recovery from surgical clipping is a gradual process that varies for each person. Right after surgery, most patients stay in the hospital for about 2 to 6 days. If the aneurysm was unruptured before surgery, the stay is usually shorter, around 2 to 5 days. But if the aneurysm had already ruptured, the hospital stay can extend up to 1 or 2 weeks because of the higher risk of complications. While in the hospital, your medical team will closely watch your neurological status. They check for signs of bleeding, infection, or other issues. Early movement is encouraged to prevent blood clots and promote circulation. Many patients can sit up and even stand within 1 to 2 days after surgery. This helps reduce the risk of complications and speeds up recovery. Once you leave the hospital, the full recovery typically takes between 4 and 8 weeks. During this time, it's common to feel tired, have headaches, or find it hard to concentrate. These symptoms can last for several weeks and sometimes even up to 6 months, especially if the aneurysm was ruptured. Rest is important, and your activity levels should be gradually increased under your doctor's guidance. Initially, strenuous activities and heavy lifting are usually off-limits for at least 4 weeks or until your healthcare provider says it's safe. You will need to keep the surgical wound dry and clean for the first 72 hours to prevent infection. Some people may experience temporary or long-term neurological effects, such as weakness, numbness, seizures, or changes in thinking. These depend on how complex the surgery was and whether there was any brain injury. Your doctor may prescribe medications to prevent seizures if needed. Follow-up appointments are crucial to monitor your progress, check for any complications, and help you slowly return to your normal routine. Activities like driving or operating machinery are typically restricted until your doctor confirms it's safe. In summary, recovery from stroke surgical clipping involves a hospital stay of a few days, a gradual return to daily activities over several weeks, and managing common symptoms like fatigue and headaches. It's important to stay in close contact with your healthcare team, follow their advice, and be patient with your healing process. Every person's recovery is different, so personalized medical guidance is essential to ensure the best possible outcome. Always consult your healthcare provider for tailored advice and support during your recovery journey.